Okay, real quick, your efforts for veterans in the VA system, it's still a huge issue. We had the Secretary of Veterans Affairs saying lines compared to Disneyland.
Right.
What's your promise to veterans when you talk to veterans about their health care?
It's not just promise, it's the action that we're already doing. Okay. I've already met with the Secretary, I've already met with the Deputy Secretary, brought him into Oklahoma. When the Deputy Secretary of the VA came into Oklahoma, we were talking specifically about getting a permanent director in Oklahoma City and getting a new director in Muskogee. We now have a new director in Muskogee. We now have a new director in Oklahoma City. There are real changes that need to be made there. A new director can help in that. We have tremendous folks that work there, and they are stuck in a non-functioning bureaucracy, and we've got to be able to help them. They've got to have leadership on board to be able to do that. The other issue is all this issue of what we hear people talk about with the choice plan. 3 years ago, Congress put in place something called VA Choice. That is, if you live more than 40 miles from a veterans facility, or it takes more than 30 days to get an appointment, you can go anywhere that you want to go and be able to work that out with the networks. I'd like to continue to press that to where I think it should go long term, and that is, if you're a veteran, you have a VA card very similar to a Medicare card. Anywhere that takes Medicare would also take veterans benefits, and you could choose any hospital, any doctor that takes Medicare anywhere in the country and not have to worry about traveling long distances to get to a VA center or to be able to wait in a long line. Our VA centers are experts in things like wound care and amputee care and PTSD and mental health care and those things. Let them do their specialization. But if it's diabetes, if it's cancer, if it's heart disease, things, those are other great hospitals around. I am tired of hearing veterans coming to my office and saying, I have waited 4 months for a knee replacement at the VA that I know they could go across the street to OU and get on Tuesday. Instead of waiting 4 months, they should be able to go where they want to go. They shouldn't have to wait that long on hearing aids, on knee replacements, on heart care, on all those things. There's no reason to put people in line, and there's no reason the Secretary of the VA should say, you know what, the lines at Disney World aren't a problem, they are here. Well, people don't die in line at Disney World. They do in the VA centers and waiting on that. So that's something that can be resolved and should.
Okay. Senator Lankford, thank you very much.